thank you again for inviting us at UNICEF to share some perspectives on what we really think is an important topic that we should be talking about more in global health. And increasingly, we are also wading into this because we feel that so many children are being left behind because we are not doing enough. So I'm Raoul Bermejo from UNICEF. I sit at the health section of UNICEF in New York headquarters, and I manage our portfolio on our work on children with developmental delays and disabilities. I must say that this is rather a new area for us, but one that presents exciting opportunities for partnerships, but also importantly to do more for children. So our work is really guided by when we think about the needs of children with disabilities, especially in the early years. It's important to think about, to start with what are the key principles when we think about providing healthcare and support for children with disabilities. And our starting point at UNICEF had always been on the rights of children and in this case, the rights of children with disabilities, anchored on the UN Convention on the Rights of Children and the UN Convention on the Rights of Persons with Disabilities. And then the ICF model, the International Classification of Functioning Disability and Health of WHO, which has been there for quite a while, also provides us a framework on how we look at this issue and how we should act on this issue. And that is really recognizing that beyond just looking at body function and structure, in fact, persons with disability, children with disabilities and their families are really concerned about what they can do, their level of activity, and if they're able to participate in society. And their activity and level of participation in society is, of course, moderated by or is a function of their health condition, but also is affected by the environment and the personal and family factors in which they operate. So the ICF model is really also about participation and inclusion, and importantly, also making children and persons with disability visible in society so that they are really able to participate. And that when we think about interventions, care, and support for children with disabilities, it is also ensuring that these are family-centered and community-based, and that recognizing the different needs and the different aspects that we need to respond to increasingly, that this is multi-professional and of course intersectoral. So we also, as with anything that we do, we need to be guided by science, and we make sure that our approaches are evidence-based. So these are the key principles that we think should guide our approaches to children with disabilities, addressing their needs, particularly in the early years. So when we think about how to approach addressing the needs of children with disabilities in the early years, we are guided by this thinking of the twin track approach, that on the one hand, we should include children with disabilities in all aspects of development in the mainstream programs. So children with disabilities should have access to existing early child development services in health, in nutrition, in water and sanitation, in early education. We need to make sure that children with disabilities are included in those mainstream programs. But at the same time, children with disabilities have specific needs. And so we also need to ensure that we address those specific needs by making sure that there are specific initiatives to identify and empower and include and provide support for children with disabilities. And the overall goal is really towards inclusion in society so that they're able to participate with equal rights and opportunities for children with disabilities. So the other way that we could look at this and help us think about in trying to address the needs of children with disabilities is this double pyramid that we adapted from the nurturing care framework of WHO, UNICEF, and other partners. And what this helps us with is to think about a stepped care approach for children and their families based on their needs. So all children and families need a certain level of support, universal support. So for example, all children and families need support in ensuring that children receive responsive caregiving and early learning. But some children we know, those with risks and those with additional needs, need further support, need targeted support, and need more specific services. So for a subgroup of children, they need more support and more specific early interventions because they have more needs. So this framework just helps us to think through and also prioritizing step care approaches to children with developmental delays and disabilities. And so we at UNICEF started then to embark and thinking, okay, how do we start identifying children with needs, further needs, and how might we organize care and support for them? My slide is not moving. Sorry. Okay, there. So let's just move this. So we have been working on a step care approach, pathways of care model to integrate different care and support services for children with developmental delays and disabilities. And the focus of this work is really on the early years. And in the early years, we're focusing on 0 to 3 years old. And the first task, of course, is to, as I said earlier already, to ensure that these children are also included in mainstream ECD programs, including health, nutrition programs, that they receive those. But we need to provide for some of them more support because they need them. And so we need to start identifying those children that need more care and support. And so we are really promoting that vision and hearing and developmental monitoring and screening should be done at specific time points in the early years, with vision and hearing even, very early. We need to find those children with vision and hearing impairment because we know that will affect their overall development. And then we need to channel them into specific pathways of care that will provide further care and support for them based on their needs. And that care and support is really anchored on a community-based, family-centered intervention for all children with developmental delays and disabilities. We need to make sure that we monitor and support their development, but that would also include caregiver education and skills training and empowering families and caregivers to provide this care and support. Now, some of these children would need further early interventions, and so some of them would require further assessment for their vision, for their hearing, for motor, for their development, so that they can access more specific early interventions for vision, hearing, for motor, for the various domains where they might need further support and help. So this is a really broad stroke way of showing how some of these approaches could come together in a comprehensive, integrated approach of providing care and support for children with disabilities. But addressing the needs of children with developmental delays and disabilities is not only about providing care and support and organizing these pathways of care that I just talked about, because stigma and discrimination is really like a very important part of the lived experience of these children and their families. And so beyond organizing these pathways of care, we also need to tackle barriers that the children and their families face. And these barriers are in society: informational barriers, environmental barriers, institutional barriers, and attitudinal barriers that exist at the individual level, but also at the community level, that needs to be addressed if we are to promote access to care and support for children with disabilities and their families. So, so that is also an important piece of that needs to be addressed if we want to provide care and support for children with disabilities. So we have done, to support this model that I just described very, very briefly, we have done a lot of evidence reviews supported by quite a broad range of partners and experts, also collaborating with WHO a lot on this. And we are piloting and exploring the feasibility of this integrated model in 3 countries: in Peru, in Bulgaria, in Uganda. And we hope that with this experience, it allows us to learn more about how do we organize integrated care services and support for children with developmental delays and disabilities. And we would be happy to share more as we learn more in this field. And so just some points to remember: that really the overarching goal of any approach should really about promoting inclusion into society. There is a compelling narrative and case around early identification and early interventions. What we know now with new brain science, we know that really the earlier we find children who need support and provide that early interventions, the better the outcomes. And we also know that community-based, family-centered approaches is really the anchor to any early interventions approach. And there's also a compelling narrative around integrating these different pathways of care, which we have observed so far, often are taken in parallel. And really the need to address stigma and discrimination in communities, addressing to ensure that children are then able to access care and support. Yeah. Thank you very much.